Oh my goodness. Dive again. Oh my days. Hello? Start with glassware. Glassware, look at us. 35 pages. A variety of glassware used in scientific work. Glassware equipment. Cytology. Hell no. Buy specimens. What's the buy? Estimation of bilirubin. Qualitative Molish test. Benedict's test. Molish test. Benedict's test. Oh my goodness. Hello enough iodine. Estimation of glucose. Alright, let's begin this shit.
I get the job done. The rain is falling. I get the job done. Drunk and falling. We are Charlie Kirk. Carry the flame. We'll fight for the gospel. Honor his name. We are Charlie Kirk. His code. We are Charlie Kirk. We carry the flame.
Alright, let's lock in. We have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 practicals. We finish them in 20 minutes each. I don't know, man. Screw it. Borosilicate. Glassware. Where borosilicate. Glass is inert, relatively lightweight, can be blown, bent, cut, blah blah blah. Borosilicate resistant to chemicals, withstands mechanical breakage, made to withstand certain heat of temperature. It's inert. I have a beaker used to hold liquids with volume 10 to 1000. Out looking ass. Alright. Test tube, transparent, inert material, resistant, blah blah blah. Fair top lip, U shape. Glass tube is either clean, minimize vaporization. Okay. Graduated cylinder. Accurate volume liquid, more accurate than glass beakers. Meniscus. Designs and contents can be swirled without spilling. They are also fitted with stoppers. Can be swirled without spilling. They are designed to fill with stoppers to minimize evaporation. Conical flask, volumetric flask, round bottom flask, Florence flask. Long neck, flat bottom bulb. Usually with a stopper. Calibrated, precise volume at a certain temperature. Precise dilutions, prepared standard solutions. Volumetric flask elongated and narrow with an etched string. Erlenmeyer flask. Conical flask. Well, let's just call it conical flask. Titration flask. Erlenmeyer has a flat bottom with approximate graduations and a conical body. Directly heated condensation for holding liquids, mixing them, swirling. Florence flask. Hybrid between the round bottom and Erlenmeyer. Ranges from Florence has a flat bottom, but then it's round instead of conical. Lucky, I am locked in, buddy. Fucking, I got a fucking dumbass practical looking ass tomorrow, bro. No one studies practicals until 2 seconds before. We got Florence flask. Okay, Florence flask. Ranges from a few hundred mLs, few liters in size. Boiling. Florence flask. Round bottom flask. And with anhydride used for titration, boiling. Yeah, POD dog. Oh, you should have seen studying shit yesterday, man. Because we studied from books. So fucking in depth and shit. And then POD from books is gonna be cancer. We only do slides for OSPs. कल practical है. Backup में ये सब test करने हैं. Hello and off test, all of this bullshit. We're also gonna do troponin test tomorrow. Thank you. How was POD? Spills. Distillation. More pipette. Morse pipette, glass pipette. It draws and delivers liquid, graduated part, rubber bulb, Morse pipette. Position. Cold. Push button, ergonomic grip cutter, tip ejector, calibration display, tip ejector, collar, tip cone. Rhinometer, bulb shape instrument that has cylindrical stem that is calibrated to give specific gravity reading. Bulb shape, Archimedes principle. Burette, graduated glass tube, top, stopcock, how to take reading. Burette must be observed at eye level, meniscus, delivers accurate amount of titrance. Glass stirrer, plain glass rod, you say. Shut up. Cuvette. Multi-like interior with straight side, circular, or square cross section. Seal at one end made clear. Transparent materials such as plastic, glass, or fused quartz. Plastic, glass, fused quartz. Spectroscopic. Okay. Spectroscopy. Human lab match with example given as urban transmitter. Spectrophotometer. Alkans tube. Polypropylene. Circular. Polypropylene. Eppendorf tube. Single tube. Polypropylene. Frosted area. Item certified free from human DNA, RNAs, PC inhibitors, tight seal, temperature resistance, inert. Storage centrifugation, mixing research labs. Mortar, pestle. Ceramic, stone material, salts, blah blah blah. Bullshit, mortar, grounded and crushed. Using the pestle. All students. Okay, we're done with one. Head on to number 2. Oh. Cold as hell, bro. Oh. Just peek. And we got a spectrophotometer. Fucking ass. Spectrometer and a photometer. What? Can I like separate this shit? Alright, spectrophotometer, spectrometer, and a photometer. Analytic is to measure the amount of light that a sample absorbs at a given wavelength. So, concentration solvent solution. How much light a sample is absorbing at a given wavelength. Okay. Beer's law. The optical density of a solution directly proportional to the concentration of solution. Lambert's law states that the optical density of a color solution is directly proportional to the path of light. Huh? Let's have a look at Mr. Google. Beer-Lambert's law. Absorbance is proportional to concentration. Absorbance is proportional to path length. Path length. What? The Beer-Lambert's law. It states the absorbance is proportional to the concentration of the solution. Lambert's law, it's the absorbance is proportional to the path of light. Okay. Sample holder, zero control. Adjustment knob. Display wavelength control, zero adjustment knob, transmittance adjustment knob. Sample holder, wavelength control, wavelength adjustment knob, zero adjustment knob, and transmittance. TLTH. Identifying impurities, detecting concentration of sample. Spectrophotometer. Incubator device has steady temperature, pressure, moisture, carbon dioxide levels for a specific time. Both have microorganisms. Heating system. On off switch, metal casing, hinge door, over ventilation, blah 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 blah. Water bath. This is electricity to keep water at constant temperature. सेंसर होता है lid, thermostat knob. This measures the amount. Hot air oven. Dry heat sterilization. Sterilization के लिए centrifuge, centrifugal force. Alexa, stop. Sedimentation. Where the higher speed sediment particles move away from the center while the smaller does not move towards the center. Lid, latch, cover, chamber, tubes, control panel. Let's have a look at what they asked today. Display. Temperature probe. pH electrode. Electrode shell. Centrifuge. Transmission adjustment knob, zero adjustment knob, and the wavelength adjustment knob. The sedimentation. Under the influence of gravitational force. C. Cell organelle virus production, nuclear amplification. Instrument used for accurate measurement of weight of chemical electronic battery. Weight of chemicals. Magnetic field to counteract the weight placed on that pad. Placed in a magnetic field. Generated by electric. Paired by water bath powered on a V0 tier mode. We have a temperature probe, pH electrode, electrode shelf, a pH meter measures the electrical and chemical potential between a known liquid inside the glass electrode. Reference to each electrode reference. Measures the electrical chemical potential between. Oh my god, twin, I'm wearing the same jacket. Oh, my bad. I didn't notice you, buddy. I'm so sorry. I was studying. So sorry, sir. What is a gag? PH meter measures the electrical chemical potential between a known liquid inside the glass electrode and an unknown liquid outside the membrane of glass electrode. Electrical potentiometric single or multiple glass electrodes connected to a bulb, selected hydrogen ions are attached to a metal rod. And the bulb within the electrodes is dipped into solution. Hydrogen ions in the solution exchange with the positive charges on the electrode, generating electrochemical potential, which is displayed. Single or multiple glass electrodes connected to a multiple glass electrodes bulb reference to the glass pH electrode. Will exchange with positive charges on the electrode, generating an electrochemical potential. Also called fume hood, fume cover, local exhaust ventilation device that is designed to prevent use of hazardous fumes, vapors, dust. Harry's fire screen pulls the safety pin. Deep side to side. Components of first aid body, bandages, and sterilized non-stick to user looking ass. We're done with 2. Sonication है sonication cell story isolation cause cell lysis release content from the cell. Chemical lysis. Lactic agents surfactants. Enzymatic method, enzymes facilitate cleavage of bonds, hydrolyze proteins, carbohydrate, protein, blah blah blah. Homogenization. Disruption of cells required for isolation, done by rotating manual. All fractionation, chromatography, electrophoresis, ultracentrifugation. All fractionation, purification technique that yeah. Yeah. I don't know. The capacitor makes it dissolved in a mobile phase through a stationary phase. Time is a measure of the amount of time taken for a solid to pass through a chromatography column. Also, retention factor. Distance moved by the compound is moved by solvent. Solute over solvent. Paper chromatography, thin layer chromatography, ion exchange chromatography. Are types of chromatography important? Paper chromatography, thin layer chromatography, affinity ion exchange chromatography, separation, stationary phase, mobile phase, thin layer to separate and identify compounds in non-volatile mixtures. Separate and identify compounds. Then share with him, huh? Share with him. Give it to him then. In their chromatography, separate non-volatile affinity chromatography. Separates proteins on the basis of interaction between a protein and a specific ligand. Ion exchange chromatography for separating compounds based on their net charge. Liquid mobile phase, solid stationary phase. Laboratory technique used to laboratory technique used to separate DNA. Laboratory technique used to separate DNA, RNA, protein molecules based on their size and electrical charge. Protein molecule size and electrical charge. Gel electric by loaded on a gel, separated on the base of their electromobility. What? SDS page? Separate proteins according to electrical mobility. SDS is an anionic detergent with J-natured protein by wrapping around the polymer. DNA is a nucleus. Mitochondria has glutamic dehydrogenase. Huh? Cytochrome. Ribosome RNA. Galactosome transferase. Lysosome is acid maltase. An electronic device that assesses gravitational separation of substances based on their masses and density. Low speed 10,000 revolutions, high speed 10 to 30,000, ultra speed 90 to 100,000. Low speed, high speed, ultra speed. Thus these substance sedimentation, substance separated based on density, gravitational force. Ensure all samples are evenly filled. Though the sample rotor has select your RPM and revolution per minute total. Time for the desired separation. Ensure the stable power source. After use, power off equipment and clean centrifuge while wearing disposable gloves. Yeah. Take from Anas. It's your turn now. Share. Lengthy per RPM. RPM versus RCI. Revolution per minute. Relative centrifugal force. Oh my goodness. RPM. How fast it's going. G-force. Relative centrifugal force. Amount of acceleration to be applied to the sample. 1.1118 times 10 power negative 5 times the radius times RPM squared. Amount of acceleration to be applied to the sample. G-force, huh? Oh my goodness, are you serious? 1.1118 times 10 power negative 5 times R radius times the RPM squared. Okay. If you high speeds, fractionation is carried out based on the density of the particles used for isolation. Separate blood from serum and plasma, separate sediment from urine. Measure the hematocrit level, hematocrit, blood, hematocrit, nucleic acid, other components, serum, plasma. What is the Buffy code? Serum minus plasma. What was it again? Serum versus plasma. Plasma that has been allowed. Blood cells and clotting proteins have been removed. Red blood cells and platelets. Differential leukocyte count, malaria diagnosis. Thank you, we are done. That's 2 down. 1, 2, 3, 4, 5, 6, 7 to go. Yes. A quality lab result begins with complete blah blah blah. Quantity missing. Tourniquet, test tubes. Capillary blood, venous blood, arterial blood. Skin of the finger, heel, earlobe, or other area. Blood connection, oxygen and carbon dioxide load. Venous blood connection in antecubital area, medicubital vein से लेते हैं. Venipuncture, correct identification of the patient position. Three to 4 inches approximately. Oh my goodness. Vacutainers. Shit. The yellow, the red, gold, yellow, green, blue. Oh, what the hell, man? Antibody. Plasma. Serum. Red Vacutainer has no additive used for RH antibodies. Gold Vacutainer is clot activator. Iron folate serum. Grey Vacutainer sodium fluoride inhibits glycolysis. Prothrombin. Sodium citrate. Heparin. For lactic acid loss, so I don't want to lose. Yellow, light blue, red, red and gray, gold, green, lavender, pink, gray. Yellow is for blood culture. Red is plain, has no additives for RH antibody. Antibody screen crossmatch. Gold Vacutainer has clot activator for iron and folate. Green is heparin, glucose, troponin, bilirubin, and troponin. Green Vacutainer, heparin, lavender, K2 EDTA, CBC, ESR, CBC, lavender, K2 EDTA, EDTA, pink, RH antibody, cross match. So EDTA, let me do it. Stream clean perineum. Occult blood ovus, infectious markers. Oncogenes, occult blood. Sputum specimen. Sputum. Bloody reciprocal frothy pink. Bronchitis pneumonia. Good morning, bloody roast. Good morning, BB. DNA session differential leukocyte malaria diagnosis. Where's the eosinophils? Eosinophils. Neutrophil. Types of granulocytes. Neutrophils and basophils. Visual 1, visual 2. Diseases. If I not a disease to humans and the environment. Bilirubin. Yellow pig. Right down, I mean. You see the yellow colored bruises. blood, albumin, accumulates in hepatic, toxic to brain, water soluble, weekly amount of albumin, accumulates in post-hepatic jaundice. Relatively non-toxic and retreated in the reset constant rate. Unconscious. Indirect route. More lipid soluble in the skin. Kidneys, liver removes it from plasma. Conjugates it, blah blah blah. Water insoluble bilirubin is converted to water soluble bilirubin. Excretion through following steps. Heme is converted to bilirubin. Water insoluble bilirubin converted to water soluble bilirubin. Bilirubin transport uptake. Principle. Bilirubin reacts with diazotized sulfolinic acid to reddish azoparol dye complex. Diazotized sulfolinic acid to azoparol dye. Van der Berg reaction. Concentration of the dye of 546 nanometers. Equivalent. This is conjugated bilirubin. Conjugated water. Direct bilirubin because it reacts directly in aqueous solution with sulfolinic acid. It's also called indirect because it needs a solubilizer and aqueous medium to react. Methanol dissolves both conjugated and unconjugated. It is used to measure total bilirubin. It can be caffeine or ethanol that precipitates protein. Caffeine is preferred. Sodium benzoate is used as a buffer, but at room temperature. Diazotized sulfolinic acid, Van der Berg reaction for bilirubin. Diazotized sulfolinic acid reacts with bilirubin to form a reddish azoparol dye, which can be spectrophotometrically measured at 546 nanometers. So this measures direct bilirubin. But to measure indirect bilirubin, we need to do it different way. We need to first solubilize it by both. The methanol, caffeine is the booster or some shit, accelerator. Sodium benzoate is used as a buffer in aqueous medium to maintain pH between 5.7 to 6.3. Reaction is carried out at room temperature. What the hell? Room temperature, sodium benzoate, look at ass. Azidopyrols. Sodium nitrite plus sulfuric acid diazotized sulfur. Bilirubin reacts with disulfuronic acid from azidopyrrol as azodipyrols. Nitrite. Sodium benzoate, sulfuric acid, sodium benzoate, sodium nitrite. Sulfur, sulfuronic acid, caffeine, nitrite, disulfuric acid. Acid form diazotyl. This one reacts with conjugated bilirubin. That is nanometer. Then we have the measure the indirect. We need to first dissolve it in methanol with caffeine as a booster, and then same reaction occurs. Total bilirubin. Total minus direct bilirubin forms indirect bilirubin. Also, we use sodium benzoate as a pH buffer, 5.7 to 6.3 room temperature. Okay, alhamdulillah, we're done with this. Pipette into 3 labels. Sample holding tubes. Mix and wait 5 minutes for reaction to complete. Blank standard sample. Blank standard sample 1000 100. So we have a Vanderberg reaction for bilirubin. We have diazotized sulfuronic acid, which is formed by sodium nitrite. Sodium nitrite sulfuronic acid forms diazotized sulfuronic acid. This reacts with conjugated bilirubin to form azopyrrol, reddish azopyrrol dye, And this is for direct, indirect dissolved methanol caffeine booster. We use sodium benzene as the buffer, 20 at room temperature. Direct, indirect is direct, total mass direct. Boom. At birth 5 mg per deciliter, at fifth day 12 mg per deciliter at 1 month. Is this jaundice or icterus? 2.5, 1 to 2 latent jaundice. Hemolysis, decreased hepatic uptake. Unconjugated urobilinogen is decreased. Urine urobilin. Urine bilirubin. Prehepatic jaundice. Diazotylsulfonylic acid reacts the azopyl ring. Okay. Methanol, caffeine. Could be doable in an hour. I hope I can finish this by 2 a.m. so I can get like good solid 4 hours of sleep. I'd be very grateful if that was possible. Okay, bismillah. We have the Molish test. This is a general test for detection of carbohydrates in a given sample. Qualitative group test for detection of carbohydrates. All carbohydrates, whether free or bound. That's not literally every single carbohydrate in the planet. Molish test. So if the carbohydrate is present, it undergoes dehydration upon the introduction of HCl or sulfuric acid, HCl or H2SO4, sulfuric acid. If carbs are present, they will be dehydrated, resulting in formation of an aldehyde. Okay. And aldehyde undergoes condensation along with two phenol type molecules, alpha-naphthalol, resorcanol. Aldehyde will condense with two phenol molecules with alpha-naphthalol or resorcanol to form a purple or reddish colored complex, a colored complex, chromogen. Alright, so if the carbohydrates are present, the H2SO4. Okay, we have hydrochloric acid, H2SO4 added. If carbohydrates are present, it will undergo dehydration to form an aldehyde. Then the aldehyde will react with two alcohols, for example, condense with thionyl and with resorcanol and alpha-naphthanol to form a purple reddish complex, chromogen complex. When monosaccharide treated with concentrated acid, OH group of sugar are removed in the form of water. Furfural is removed from formed from sensation. Violet red complex. So we have purple reddish complex. So we have a purple ring formation. Purple ring formation. Alpha naphthalol. Naphthanol. Purple ring is a positive indicator for Molish test. Molish reagent. This is prepared by dissolving 1 milligram of alpha naphthanol in 95% ethyl alcohol and making the volume up to 100%. Concentrated sulfuric acid.
Life happens wherever you are, whether you make it or not.
2 ml of sample in dry test tube, 2 ml of distilled water in another test tube as control.
With a poor stance, you are unbalanced and you can be easily knocked over.
2 ml of sample in a dry test tube, 2 ml of distilled water in another dehydrated. I'm just gonna take a screenshot of this. Molish test. Not fair. Send it to myself. Boom. Okay. Purple ring formation. There's a purple complex. Boom. Take 2 ml of sample. Distilled water. Another test tube as control. The solution. 1 ml of concentrated. Out of the tubes and then tubes. Affirmation ring, do not shake content because it will distort the ring shape. Clinical significance. Are important food components, effect on taste and nutrition. Determination of type and concentrations of carbohydrates in foods is integral for nutrient labeling, quality control, and different. Carbohydrates in different samples. It can be used to detect the formation of carbohydrates as a byproduct in different fractions and distinguish other biomolecules. Trioses and tetroses do not have the necessary 5-carbon atom for the first formation, so they do not give a positive result. This reaction. Trioses and tetroses have to be 5-carbon at least. Most test is not a specific test for carbohydrates. Profile yielding substances such as organic acid, lactic acid, oxalic, citric acid also give positive result. Oxalic acid, formic acid also give positive result. The tetroses do not give this test. Okay, moving on. Let's just talk about this before. So we add concentrated sulfuric acid or H2SO4 or hydrochloric acid, and if carbohydrate is present, it's going to dehydrate to form an aldehyde. Aldehyde will react with alpha naphthanol and resorcanol to form a reddish purple chromogen complex. Trioses and tetroses do not do it. Oxalic acid. Boom, we're done with this shit. Now we've got 3. Are you serious? Bilirubin, where's the bilirubin at? I feel like going to take. Okay, fasting plasma glucose is the levels. Right after being has not been fasting until hours. This is usually first thing in the morning before breakfast. Less than 99 mg per deciliter. Pre-diabetic 100 to 125, 126 or higher. Okay. Random. Before and 2 hours after drinking a sweet drink. Glucose is also normal. Is less than 160 after an hour, 140 after 2 hours. Impaired glucose intolerance. HbA1c test measures your average blood glucose for the past 3 months. In the test, you don't have to fast your drink. 5.6, 5.7. When Benedict's test. Reducing substances in it. Okay. Test is a simple biochemical test that is used to detect reducing sugars. Reducing sugars are carbohydrates that have free aldehyde or ketone function. Current जो है हम करते हैं reducing sugar इसके लिए तो वो sugar है free aldehyde या ketone group होता है. In their molecular structure is qualitative and semi-quantitative test. It is a very sensitive test. All monosaccharides, some disaccharides reducing lactose, maltose. Both carbonyl groups are in solid starch are non-reducing. When reducing sugars are heated in the presence of an alkali, they become powerful reducing compound known as enediols. They become enediols. Reducing sugars are heated in the presence of an alkyl. They become enediols. Enediols reduce the cupric ions present in the Benedict reagent. Cuprous ions. Reagent में है क्या? अच्छा, enediols reduce the cupric Cu2 plus ions to cuprous ions Cu plus. Reduces Cu2 plus to Cu plus, which gets precipitated as insoluble red cuprous oxide Cu2O. Cuprous oxide. Copper sulfate provides copper ions. Has copper ions. Sodium carbonate. Copper sulfate, sodium. Sodium carbonate provides the alkaline conditions required for the redox reaction. Sodium carbonate. Sodium citrate acts as a chelating agent. Prevents precipitation of sugar, alkyl, enediol. Cupric ion becomes Alright, so in alkali conditions, reducing sugars they react with in an alkali medium to form heat and residue of alkali become enediols. Enediols oxidize cupric ions to cuprous ions, reduce cupric ions to cuprous ions, which precipitate to form cuprous oxide, which is red cuprous oxide. Really large. Which precipitates copper sulfate, sodium citrate, and sodium carbonate. And Benedict for reducing sugars. So reducing sugars in alkali medium, they form anidiols. Anidiols, they are strong reducing agents. They reduce cupric ions into cuprous ions, which precipitate as cuprous oxide, red cuprous oxide, as red cuprous oxide. So the copper, so it has copper sulfate, sodium carbonate, sodium citrate. Copper sulfate provides the carbons, copper ions. Sodium carbonate, sodium citrate. Sodium citrate is chelating agent. Sodium carbonate makes the alkaline conditions. Copper sulfate provides the copper ions. We have sodium carbonate and sodium citrate. Sodium citrate acts as a chelating agent, and sodium carbonate provides the alkali medium. CuOH2. What is CuOH2? Copper hydroxide. Copper sulfate, sodium citrate, sodium carbonate. Sodium citrate, sodium carbonate, copper sulfate. Copper sulfate provides the copper ions. Sodium citrate acts as a chelating agent, preventing copper hydroxide formation, and sodium carbonate gives the alkali medium. Take 5 up, add 8 urine sample, keep for 2 minutes, let it cool. Zero 0.5 to 1 gram per 100 ml. 1 gram per 100 ml green. And yellow is 0 to 0.5 to 1. Carbon, ascorbic acid, vitamin C. Vitamin C is a reducing agent. Yeah, it is. Aspirin. Helling's test. Are we not done? Sodium potassium tartrate is used instead of sodium citrate. Sodium citrate gives sodium potassium tartrate in musical. Form complex Cooper's hydroxide prevent precipitation, non-quantitative and more sensitive than Benedict's. Glucosuria, fructosuria, and galactosuria. Table and stored in 2 parts. No, wrong alcohol. Sodium potassium tartrate instead of sodium citrate. Sodium citrate, sodium carbonate, and a copper sulfate. Using sugars and alkali become anidiols, anidiols, cuprous, cupric, and cuprous oxide, red cuprous oxide. Okay, we're done with this too. Really went off test. Iodine test. I need to go to the bathroom. I must go to the bathroom. Selivanov test detect ketohexoses and keto sugar containing. You see keto sugars, ketos and aldoses. Timed color reaction to ketohexoses. For keto sugars, okay. Classification. Aldose versus ketones. An aldose one aldehyde group per molecule. Ketone contains one ketone group per molecule. Aldoses tend to isomerize to ketoses. Aldoses tend to isomerize into ketones. Ketones only isomerize into aldoses if the carbon is at the end of the chain. Selivanov test, aldoses react slowly and produce light pink color. Ketones react with resorcinol to give a deep cherry color. Ketones, ketones. Resorcinol, deep cherry color, light pink color. aldehyde ग्रुप होता है इसमें कीटोन ग्रुप होता है
hard to pronounce twice in a row.
Let's lock in. It's to the ketos, keto sugars, ketos, aldose, keto have ketone, aldose, aldo. So some consist of concentrated HCl and resorcinol. Acid hydrolysis of polysaccharides and oligosaccharides yields simpler sugars. HCl dehydrates pentoses to furfuryls and hexoses to furfuryl derivatives. Furfuryl derivatives. 5-hydroxymethylfurfuryl reacts with 2 equivalents of resorcinol in a series of condensation reactions to produce a complex xanthanoid with a deep cherry red color. Acid polysaccharide simpler sugars. Alpha-dehydrated pentoses to furfuryls, hexoses to furfuryl derivatives. 5-hydroxymethylfurfuryl reacts with 2 equivalents of resorcinol in a series of condensation reactions to produce a xanthanoid. HCl जो है वो pentoses और hexoses को break down करता है. Just for breakdown reaction. HCl and resorcinol. HCl causes a breakdown of polysaccharide oligosaccharides into simpler sugars. So pentoses react with HCl to form acid dehydrated pentoses to form furfuryls, and hexoses to form furfuryl derivatives such as 5-hydroxymethylfurfuryl. And then this reacts with resorcinol in a series of condensation reactions to form xanthanoid complex, which has a deep cherry red color. Furfuryl derivatives of keto sugars dehydrate more rapidly in the acidic medium, as with aldo sugars, which form the basis of cell test. Aldo sugar from the same furfuryl derivative and same color with resorcinol but take more time. Pink cherry color. So the concentration of acid, heating, reaction time of the final products help distinguish between carbohydrates. Other carbohydrates like sucrose and insulin also give a positive result, as these contain fructose. Sucrose and insulin also give a positive result. Just do it more slowly. Okay. So the solution of reagent had HCl and resorcinol. HCl causes a breakdown of polysaccharides and oligosaccharides into simpler sugars. So pentoses acid, the acid HCl dehydrates pentoses into furfuryls and hexoses into 5-hydroxymethylfurfuryl. This then reacts with resorcinol. Equivalents of resorcinol to condensation to perform xanthanoid, which is a complex, and it has a cherry red color. Aldoses now, they also react with it, but they react much more slowly, which makes the basis of this test. They can react to paint pink. Aldose, no collision negative. Sucrose. Ketose is appearance of color after a prolonged period of time. Aldose. Acids overheating to detect essential fructosuria, infusion and fermentation medium, glucose or other with similar colored compounds Prolonged boiling, data false positive. There's no distinction between specific key doses. Generalized test. Thank you very much. I appreciate it. Iodine test. But that took like 8 minutes, didn't it? When I properly logged in, that took 8 minutes. Iodine test is qualitative test used for detection of polysaccharides except cellulose. इसीलिए ब्रेक डाउन करेगा पेंटोज को हम फरफरल में फरफरल हेक्सोज को जो है 5 हाइड्रोक्सीमेथाइल फरफरल रिएक्ट करेगा टू रिजोर्केनॉल कंडेंसेशन रिएक्शन फ्रॉम ज़ैंथेनॉइड. ये क्रोमोजन कॉम्प्लेक्स जो है वो मोलिश में बन रहा है. रेड प्रेसिपिटेट बन रहा है क्यूप्रस ऑक्साइड. Iodine test is qualitative for cellulose. Oh, polysaccharides except cellulose. Oh no. Negative iodine test. Detect starch, है ना starch. Dextrin, starch, glycogen based and different. Starch के लिए. And these are only one type of monosaccharide. Starch, glycogen, cellulose. Heteropolysaccharides. Glycoprotein gags. But what is a gag? Animal or reddish brown with iodine, blue black color with iodine, and blue black is positive, reddish brown. Iodine molecules are adsorbed on the surface of larger molecules like those of polysaccharides. The iodine message. At least 8 monomers linked in a linear manner are required to give a positive iodine test. A complex of ill-defined nature. Why does it feel like it's the first time I'm ever doing the iodine test? I feel like I skipped on it before or something. Hope it doesn't come. So iodine, it goes and absorbs to large polysaccharides, basically more 8-1 specific color, and because alpha 1 4 solution. Iodine solution, sodium hydroxide, HCl, starch. Glycogen will give red color. Glycogen gives red color. Dextrin. Blue black starch, reddish brown is glycogen, reddish purple is dextrin. Oh no! Oh, all I know. No change in color means no polysaccharide present in blah 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 blah. It is red brown if we have the presence of glycogen. Red purple if we have the presence of dextrin. Yes. And 10% sodium ion by drop to the color superior. This shows that the iodine is positive only in acidic medium. Acidic medium. Lower temperatures, once the solution cools down, this color will appear. Low temperatures and acidic solution. When dextrin shows the phenomenal color, do not come back due to permanent change in dextrin molecule. Blah 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 blah. Precautions. Do not perform iodine in alkaline medium. Do not do high in high temperatures. Do not pour too much iodine. Else. Starch in example. Starch, glycogen, dextrin. Frey syndrome. What is Frey syndrome, bro? Oh, excessive sweating and flushing on the cheek. Ah. Excessive sweating and flushing on the cheek. Temple. Been thinking about food. Parietal gland or the amount of starch present in the sample cannot be tested. Diabetes is a multifactorial chronic disorder, deficient resistance of normal. Gestational diabetes, neonatal diabetes, drug-induced diabetes, fatigue, weight loss, polyuria, polyphagia, burning. HbA1c is greater than 6.5%. Fasting plasma glucose is greater than 126 milligrams per deciliter. 2 hours greater than 200 grams. Random is more than 200. Microvascular macrovascular complications. Nephropathy, neuropathy, retinopathy, blurred vision, loss of eyesight, cataract formation. Yes, that is a very important one. Cataract formation. Nephropathy, neuropathy, retinopathy, macrovascular heart attack, atherosclerosis, stroke, peripheral vascular disease. Disease in blood vessel, neuropathy, degeneration, polydipsia. Nephropathy, neuropathy, retinopathy, heart attack, stroke. Glucose is oxidized to gluconate by the enzyme Glucose is oxidized to gluconate by the enzyme glucose oxidase. Gluconate, okay. And with the formation of hydrogen peroxide. Hydrogen peroxide बनता है. With phenol and 4-amino antipyrine, red color compound quinone in the presence of enzyme peroxidase. Peroxidase. Yep, makes sense. 4-amino antipyrine, phenol, hydrogen peroxide with quinone. Ah, quinonamine is just quinone. The intensity of the red color is directly proportional to the oxidized gluconate. H2O2, 4-amino antipyrine, peroxidase, red quinonamine dye, and it's kind of easy, chat. We're done pretty quick with this one. Chat, we might be done pretty quick with this one. Glucose gets and this hydrogen reacts with 4 amino antiparticles. And peroxidase catalyzes the reaction to form water and phenol, which is high. Oh. No, please, please. No la vida. No. No. So we've been confirmed 4 marks in block 1 already. And we just need 4 more marks in block 1. I don't know I could do it. Glucose gets oxidized by glucose oxidase to form gluconolactone, gluconate, glucose oxidase, and hydrogen peroxide, 4 amino antipyrine, phenol, quinonamine, red dye, water, intensive red color concentration, glucose. Right. What else there? Reagent, waters. Insulin overdoses, insulinemia, insulinoma. Seizures, coma, death. Hypothyroidism. We're done. We're done with block 1 now. How many pages is that? Pages is pretty. We're going at a rate of 100 pages an hour, so we're expecting 2 more hours. But I feel like it'll a tiny bit more. Rancidity of fats. Let's open with Google Slides. We have next estimation of cholesterol. Protein kinase, LDH concentration. Open in. Brother. I'm gonna take a tiny break. I'm gonna take a 5-minute break. Mm-hmm. 4-minute break. Thank you very much.
See you guys. Dude. It's another. Hey, excuse me. Excuse me. Just. Dude. It's dead. It's another. Hey, excuse me. Excuse me.
Hello, bro. Big fan. Hey, what's up, bro? I'm Donnie. Oh no. Who are you? Brother, who are you, bro? Find out. Oh, this one is bullshit. Rancidity of the fucking acid, yeah? Chloroglucanol of fats is the process of complete or incomplete oxidation of hydrolysis or hydrolysis of fats. Incomplete air, light, or moisture by bacterial action resulting in implantation order. As compared to ghee. Standard oils are less prone to rancidity. The more complex the structure of the fat with more double bonds, more prone it is to rancidity. Complete oxidation, complete hydrolysis of fats. Hydrolytic oxidative microbial rancidity. Hydrolytic rancidity, ester hydrolysis. Oxidative rancidity, oxidation at the double bonds. Microbial rancidity, microbial. Enzyme hydrolysis. Oxidative rancidity involves oxygen damage to foods. Oxidative rancidity, microbial rancidity, and hydrolytic rancidity. Oxidative involves oxygen damage to foods. Oxygen molecules interact with the structure of the oil and damage the structure in a way that can alter the odor. Fat is oxidized and decomposes into compounds with shorter carbon chains. Decompose into compounds with shorter carbon chains such as fatty acids, aldehydes, and ketones, of which are volatile. Used to formation of both unpalatable and toxic compounds. It will split the fatty acid chains away from the backbone. That's right. Fatty acid. Further on oxidation leading to oxidative rancidity. We'll split the fatty acid chains. Ones. Damage structure, making it unpalatable and toxic. Compound with shorter chains. And can produce enzymes called lipases. Indirectly interfere with the triglycerides and produce fatty acids and glycerol. These fatty acids oxidation leading to oxidative rancidity and the rancid odor of the facids. The microbial lipase requires suitable pH in other conditions. Okay. Hydrolysis. Add antioxidants. Addition of antioxidants. Antioxidants. Selenium. Vitamin C, vitamin E, selenium. Sequestering agents. They bind metals, preventing them. What is EDTA itself? Like what like you keep on saying EDTA. What is EDTA? Chelating agent used to bind metal ions, iron and calcium. acidity and citric acid. I give my all. Fishing agents, antioxidants, proper storage. Cool dark place with the reaction. Cool dark with the reaction with oxygen or vitamin A, vitamin D, vitamin C, ADC, butyrate, hydroxytoluene. Butyrate, hydroxytoluene, butylated hydrox, and so butyrate, hydroxytoluene. Butyrate, hydroxytoluene, I'm not memorizing it. Fluoroglucanol is a phenol with 3 OH groups. It's such a stupid principle, right? It's like so simple. I'm not complaining though. Fluoroglucanol is a phenol with 3 hydroxide groups at 3 positions in the benzene ring. In 3 positions in the benzene fluoroglucanol, it's a phenol that has 3 hydroxyl groups in 3 different positions in the benzene ring, and it reacts with aldehydes and ketones, and in acidic medium, a red-colored complex. To quantum of density. Ketones are things of water have fluoroglucanol. You got fluoroglucanol in the react. It has 3 hydroxyl groups. Um, Fluoroglucanol that has 3 hydroxyl groups and it reacts with hydroxyl group in the benzene ring. It reacts with aldehydes and ketones to form a red colored complex. Acidic medium to form red colored complex. Wow, very nice. Fat sample. TK results red, false positive ketones. Rancid harmful free radicals in the body. Cellular damage, tissue damage, organ failure, cancer. Wells can also cause digestive distress, displied the body of vitamin B, vitamin E, vitamin B, vitamin E, vitamin B, huh? DNA, accelerate aging, promote tissue regeneration, cancer development. Crab boss, yeah, how you doing, buddy? What you want? Moving on to the next one. You might be doomed tomorrow. You might be doomed tomorrow. I think you're kind of lying. I feel like you're kind of lying, chat. I feel like you're kind of lying. Kind of lying to me, chat. I woke up from a 1-hour nap. How long was it meant to last? I have done 1 chapter of proteins and organelles. Damn. I mean, to be fair, you might just remember the rest of it. 6 hours, shit, bro, you kind of cooked, I can't lie. I'm trying to think of a way maybe you're not cooked, but I feel like you kind of cooked. But to be fair, you did good in the MCQs for biochem. Everybody started good for biochem. Sometimes you just remember on the spot. You won't like know now, but when push comes to shove, you'll know. It'll all come falling like puzzle pieces and shit. Yeah, do the important shit. Just do the important shit. The rest of it you'll just remember. Introduction. Lipid profile कर लेते हैं हाँ जी. How's your prep going? मैंने 9 बजे शुरू की थी instead of at that time. I wish I started that time. I would have been done by now. But LDH timings. ठीक वैल्यू हाँ कर लूँगा. काश मैं यार उस वक्त शुरू कर लेता. आज मैं अभी सोने जा रहा होता मैन. Not even hard, bro. LDH timings मैं यहाँ लिख भी देता हूँ. LDH types and timings in injury when no worries, I didn't sleep last night because of this either. I'm probably gonna sleep by 3. I'm not gonna do all the hyper. वो क्या था वो electrolytes के जो इतनी ज़्यादा diseases थी. When does it increase, decrease? वो वाला मैं तो नहीं कर रहा. I ain't doing that for 1 or 2 marks, bro. Are important. नहीं वो तो सही है ना. एल्बुमिन कब इंक्रीज होता है? वो इलेक्ट्रोलाइट ही है ना. इलेक्ट्रोलाइट ही है क्या है? एल्बुमिन इलेक्ट्रोलाइट है. एल्बुमिन वो ग्लोबुलिन वो रेशो. दैट्स फाइन, आई कैन डू इट, दैट्स इजी. लेकिन उसके बाद जो था वो तो प्लाज्मा प्रोटीन है. Oh shit, bro. Okay, I guess I'll do it. Guess I'll do it. LDH1 is in heart, red blood cells, or RBCs, kidneys. Lungs, lymph nodes. Thank you. Thank you very much. Good luck. Lungs. White blood cells, lymph nodes, skeletal muscle. Hydrophobic compound. Most abundant cholesterol from the diet is de novo. In the liver and intestines. Maintains fluidity, clathrin coated pits, lipid rafts, calvuli, नहीं ना. Insulin, installation in myelin sheath. Fluidity, clathrin coated pits, lipid rafts. Bile salts, vitamin. So they have functions outside the cell membrane, within the cell membrane, inside the cell membrane. Insulation of myelin sheath within the cell membrane, maintaining fluidity of the cell membrane. Clathrin coated pits, mediated phagocytosis, endocytosis, and then we have calvuli and lipid rafts. Esters present in the sample are esters are Cholesterol, free fat, cholesterol oxidase. Cholesterol is then oxidized by cholesterol oxidase to cholesterol gluconate. Cholesterol and hydrogen peroxide reacts with water and excess. This is to water and excess oxygen and something. Cholesterol, cholesterol, hydroxide, phenol, fermented peroxidase, quinone, and water. This is beautiful. Cholesterol esterase, cholesterol free fatty acid, oxidase, cholesterol, hydroxide, phenol, fermented pyridine, quinone for H2O, ठीक है. Red color dye. ये हमने दो कर. Chloroglucanol, glucanol. Chloroglucanol, it has a benzene ring. It reacts in condition. Ketones and aldehyde form. Sodium citrate, sodium carbonate. Total cholesterol should be less than 200 milligrams per deciliter. More than 240, borderline 200 to 240. LDL should be less than 130. HDL low risk is less than 40, more than 50 milligram per deciliter. Less than 130, 130, 116 above is dangerous. I'm dangerous. Less than 130, 160, got a problem. 200, 240 है, ठीक है. LDL का 130 है, 160 है. Sclerosis, diabetes mellitus, type 2 hypothyroidism, chronic appendicitis, pancreatitis. Causes of hypercholesteremia. Hyper में है nephrotic syndrome, diabetes mellitus, obstructive jaundice, hypothyroidism, alcoholism, malabsorption, pernicious anemia, hypercholesteremia, pernicious anemia, malabsorption, hyperthyroidism. Okay. Hypercholesterolemia, we have diabetes mellitus, obstructive jaundice, hypothyroidism, and in hypercholesterolemia we can have malabsorption, pernicious anemia, and hyperthyroidism. For hypercholesteremia, diabetes mellitus, we have nephrotic syndrome, we have hypothyroidism, obstructive jaundice, alcoholism. और अगर हम बात करें for hypocholesterolemia, it can be because of malabsorption, it can be because of pernicious anemia, and hyperthyroidism. Okay. This is hypercholesterolemia type is low insulin to glucagon ratio, negative hormone sensitive lipase, increased fat metabolism, increased fatty acid, nuclear oxidation, increased acetyl-CoA, increased acetyl-CoA, channel to cholesterol biosynthesis, hypercholesterolemia. Biochemical basis of hypercholesterolemia and nephrotic syndrome. In nephrotic syndrome, we have loss of hypoalbuminemia. VLDL, LDL. Hypoalbuminemia, VLDL. And hypothyroidism decreased, decreased. In hypercholesterolemia, in hypothyroidism, will have decreased expression. Decreased LDL receptor, decreased LDL, hypercholesterolemia. And hyperthyroidism will have more LDL receptors. Okay. And obstructive jaundice in the bile duct, bile acid flow, consolidation, cholesterol utilization for bile salt. In chronic alcoholism, NADH to NAD ratio. Familial hypercholesterolemia type 2, hyperlipidemia. LDL receptor defective binding of the receptor. Diabetes may decrease insulin, have more acetyl-CoA. In nephrotic syndrome, we have albumin, so more real LDL synthesis. In hypothyroidism, we have decreased LDL receptors. In obstructive jaundice, the cholesterol is not being in the bile, so it's just going to be inside of blood now instead. In chronic alcoholism, we'll have increased NADH to NAD ratio, so the TCA cycle stopped, and we have movement into the cholesterol biosynthesis. Okay, alhamdulillah. We're done in cholesterol esterase, cholesterol oxidase, cholesterol, and hydrogen peroxide for amino antiparine phenol. Okay. Boom. Now we got 1, 2, 3, and 4. Still 4 left. Are you serious? Selivanov test is 4. Ketosis and aldoses, I think. Carbohydrates and stuff. Increasing sugars. Selivanov aldoses. Let's make out there. Pentoses become peripherals, hydroxyls, and this kind of good. Good color xanthanoid, bro. Xanthanoid deuterated. Okay. Lipid profile. LDL, HDL, tag, total cholesterol. Cholesterol to HDL ratio. Elevated levels of lipid like cholesterol and triglycerides in your blood. This can hyperlipidemia. Imbalance of lipids, cholesterol. Low density LDL, bad cholesterol. Total cholesterol, HDL, triglycerides from these LDLs calculated by Fertile Walls equation. LDL is total cholesterol minus HDL minus triglycerides over 5. Fertile Walls equation. L से हम LDL कैलकुलेट करते हैं. It's a bad cholesterol. Normal lipid profile में हमारे पास है LDL, HDL, tag and total cholesterol. अब LDL जो है हम डायरेक्टली मेजर नहीं करते हैं. We basically subtract total cholesterol minus HDL minus tag, and all of it is divided by 5 to form the LDL Fertile Walls equation. High energy, hyperprotein HDL, good cholesterol, reverse cholesterol transport. ATP binding side proteins. 130 से कम हो तो अच्छा है, 130 से 60 रिस्क है तो ज़्यादा हो गया, 60 से ज़्यादा अच्छा है। सर family, MI, overweight and sedentary lifestyle, diabetes, smoking है, cholesterol है every 1 to 2 years, 45 to 60. फैमिली हिस्ट्री है, स्मोकिंग है, डायबिटीज़ है, ओवरवेट है, करना चाहिए फिर फॉर पेशेंस। Last 10 to 12 hours, meaning no water except water, no water intake basically. Invasive invisible blood, serum or plasma, routine venipuncture. Analytical methods for lipoprotein estimation. Glycerol kinase method. Tags. Type as free fatty acid, glycerol, glycerol kinase, glycerol 3 phosphate, glycerol 3 phosphate, oxidase, dioxidone, dehydrogenase, you mean? Dihydroxyacetone phosphate, dihydroxyacetone phosphate. Parachlorophenol, peroxidase quinolamine. Okay. Very complex measures spectrophotometrically. The mechanism proportional to the concentration of tags in the given sample. Free fatty acids are present in the sample. The tags are broken down by lipases to free fatty acids and glycerol. Glycerol is then phosphorylated glycerol kinase, glycerol phosphate. Glycerol phosphate is then dehydrogenated glycerol phosphate dehydrogenase from dihydroxyacetone phosphate and hydrogen peroxide. Hydrogen peroxide then reacts with 4-amino antipyrine and parachlorophenol this time to form quinonamine, red color complex. Peroxidase enzyme right there. Spectrophotometrically at 500 nanometers, and is proportional to the concentration. For tags, reagent, tags less than 200. Greater than 400. Oh no! Total cholesterol dual tags. Tags removed by lipase, free fatty acid, glycerol, glycerol kinase, glycerol 3 phosphate dehydrogenase, glycerol 3 dihydroxyacetone phosphate, hydrogen peroxide, pyrochlorophenol, 4 amino antipyrine, and boom, here we're done. Okay. Hypertriglyceridemia, familial chylomicronemia, hypertriglyceridemia with the familial poorly controlled diabetes. Type yes. Type yes. Create the racetrack, we can ask copy. Make you laugh and cry, eclipsing all your summer skies. Some things never change, and I need it more than love, and I love it more than life, and I want those stars above to shine this night. There you go. God damn, alright. You've been practicing, huh? Stab a sorry heart with your favorite finger. Stab a sorry heart with your favorite finger. Paint the whole world blue and stop your tears from stinging. Hear the cavemen singing. Good new. Oh my goodness. They're bringing 7 seas, swimming them so well. Oh, that shit. Glad to see my face among them, kissing the tortoise shell. I fumbled bad on this one, bro. Oh my goodness. What on earth was that, bro? Alright, we're starting the final race. We're doing anything but study. We may climb into the thin and cold realm. We may climb into the thin and cold realm of pure geometry and lifeless science, or sink into that of sensation. Between these extremes is the equator of life, of thought, or spirit, or poetry, a narrow belt. 70. Alright. We're chilling. Not the best, not the worst. Alright, gotta study. Oh my goodness. We'll do this shit, please. Lock in the Abdul. Join in. Quick, monkey. The pickpocket's profession demands extraordinary. What the hell is this text, bro? The pickpocket's profession demands extraordinary nimbleness and agility. Terrific certainty of movement, not to mention a ready wit, a talent for observation and strained attention. God damn. Alright, Mr. Abdul. Oh my goodness, bro. This is glitched. What on earth is this paragraph? We're going to be located around the country. We're in communication with each other. In 1969, 4 computers located around the country were in communication with each other through ARPA. By the mid-1980s, core of the network was in place. The communication protocols had been determined and the internet was live. By the early 1990s, the first internet language, HTTP, was written and the first browser was published. The World Wide Web was born. Oh my goodness, am I a loser? I put her I put her not observations from the language. Smoke. Energy hit me. Bartolow's equation. VLDL is times 5. Creatine kinase in blood. Creatine is also known as creatine phosphokinase. Brain, lungs, GIT, cardiac muscle, and skeletal muscle. Phosphate from ATP to gluten from ATP and phosphogluten. Creatine kinase phosphocreatine serves as an energy buffer, rapidly regenerating ATP from ADP during periods of high energy demand. Monotestosterone generated behind the organ not from is one form. We have the Benedict's test, Kuprecoin, Kupresan, Canada formation, the confinement, TCAM. Then we have the Sullivanov test में aldehydes और ketones का होता है. They form furfuryls and 5-hydroxymethyl furfuryl. Furfuryl. Xanthanoid. Glucose oxidase forms gluconate and hydrogen peroxide for vanity. You know what I mean? During high energy demand, energy transport shuttle, transferring high energy phosphorus from cell production, mitochondrial utilization. Kinase levels, exercise जो है कुछ medical statin effect. Rate of formation of NADPH at 340 nanometers. Phosphocreatine plus ATP, creatine ATP plus glucose. Kinase, glucose 6-phosphate, dehydrogenase, gluconate 6-phosphate. NADPH. Phosphocreatine में जो ATP बनता है, phosphocreatine and ATP binds the glucose 6-phosphate dehydrogenase forms gluconate 6-phosphate NADPH. 340 nanometers. Okay. So phosphocreatine plus ADP to form creatine plus ATP, and this requires phosphocreatine kinase. Then this ATP is used for glucose. ATP plus glucose to form isokinase. Glucose 6-phosphate, and goes to the SMP showing glucose 6-phosphate dehydrogenase. NADPH. Formation of NADPH is directly proportional to enzyme activity. Absorbed at 340 nanometers. CKMB rapid test. To 140, to 170, normal range I have 70, 30 to 145. Okay. Statins. 50 to 170 in men, 30 to 145 in women. Eco levels in MI. Green fraction. After 3 to 6 hours of MI hours. EKMB 1, 2, 3, 4, 5, 6, 7. Big level. CKMB index is CKMB mass over total CK mass times 100. Less than 5%. Let's CK, let's do LDH real quick. Found in almost all cells of the human body. LDH1 is found in RBCs. LDH1 is found in RBCs in the heart. It was also found in the RBCs in the heart, but one is usually more than 2. Right? One is usually more than 2. Right? Liver, skeletal muscle. Liver. Obviously जो है pancreas में है. Pancreas. Twenty-four to 48 hours, peak at 2 to 3 days. 1 to 10 for 15 days. Aldase one almost lactate dehydrogenase converts pyruvate into lactate. Pyruvate is important. Lack mitochondria. Heart, RBCs, brain. What? Heart, RBCs, and brain. LDH2 is in the white blood cells. LDH3 is in the lungs. This is completely inaccurate and very, very wrong, by the way. That's kind of pissing me off as well now. LDH1, LDH2, LDH3 in heart, red blood cells, brain. LDH2 is in white blood cells. LDH3 is in lungs. LDH4 is in kidneys and pancreas. LDH5 is in liver and skeletal muscle. Liver, LDH4 kidneys and pancreas. 5. LDH1 is found in the brain, blood, in the heart. LDH2 is found in white blood cells. LDH3 is found in the lungs. LDH4 is found in the pancreas and kidneys, and LH5 is found in the liver and skeletal muscle. Non-hemolyzed serum or EDTA plasma. LDH बहुत ज़्यादा होता है. Serum हमें यूज़ करना होता है, non-hemolyzed serum यूज़ करना होता है because RBCs themselves, they contain a lot of LDH and that's going to mess up the results. So we just want to know about this in the serum. Live for 2 to 3 days or solution of pyruvate acid lactate. NAD is convert NAD. Pyruvate, NADH. Rate of NADH disappearance is directly proportional to. Oh wow, this is a very very nice. I love these sort of principles for LDH. ठीक है, उसका ये आ गया. ठीक है, pyruvate plus NADH plus H to form lactate and NAD. Rate of NADH disappearance. LDH catalytic activity. Beautiful. One 40 to 280 units per liter. LDH4 is found in the kidney. Liver disease. What is prognosis? Testicular seminoma. Hepatitis. All consumption. Mollusk. Lung disease, TB. Hepatitis हो गया. Over delayed. Because it rises in the blood in 24 to 48 hours and then it peaks in at 2 to 3 days and then it LDH 2 is more than 1. Physiologically, LDH 2 is more than 1. LDH, more than 2 pathologically. LDH 1 over 2 ratio is 1. Flipped LDH. He's a sarcomeric calcium regulator prescribed. I'm actually acting in Trop T is more sensitive, Trop I is more specific. Trop T is more sensitive, Trop I is more specific. Oh, sensitive. Drop an I to have more specific. Ischemic phase, necrotic phase, inflammatory phase, healing phase, remodeling phase. We have an ischemic phase, obstructed blood flow in coronary artery release. Ischemia can last for minutes to hours. Necrotic phase for a few hours or several days. Several days characterized by necrosis. And inflammatory phase from several days to weeks. Body initiates an inflammatory response to clear dead cells and debris. Healing phase for scar tissue takes several weeks. Remodeling phase occurs over months. We have 5 phases. We have the ischemic phase, which will last minutes to hours, and then we have the necrotic phase, which can last hours to days, several days. Necrosis, and then we have the inflammatory phase, which can last several days to weeks. Several weeks. So in response to the necrosis, it does have information to move them. Then there's the healing phase, which lasts several weeks to months. Weeks, days to weeks, weeks to several weeks, months. And healing phase of that, remodeling phase, healing phase of our tissue. EKMD, do them up. Troponin T is more sensitive, troponin is more specific. B. Chest pain relieved with the left arm. Left armpit, back, or jaw, neck. Breathlessness, nausea, vomiting, fatigue, dizziness, sweating, Zero to 0.01 nanograms per ml. Immunofluorescent assay uses to detect troponin T level. The test strip contains two monoclonal antibodies specific to cardiac troponin T. Which one is gold labeled, the other is biotinylated. There are two monoclonal antibodies, MABs होते हैं specific to cardiac troponin T. Which one is gold labeled, the biotinylated. From a complex recovery to plasma passes through the detection zone. Gold labeled troponin T sandwiches complexes accumulate. And which complexes accumulate and positively manipulate. And immunofluorescent assay है detect troponin T levels in the blood. तो होता है it's made of contains two monoclonal antibodies troponin T. एक gold labeled है और एक biotinylated है. And their function is to form a complex with cardiac troponin. So whenever the plasma it passes through the detection zone, the gold plated one, gold labeled one, gold plated one. What did you say? It sandwiches it. The complex accumulated. The line. And specimen area dropper. Gold plated or biotinylated the form sandwich complex cardiac troponin T. Whenever the plasma passes over the detection zone, the gold labeled one it forms sandwich complexes, and the more of these complexes are formed, the more red line is displayed. Negative invalid testing. Easy to use. You can use whole blood. Usually, instantly. Fitness exercise. Next, scoring acid, bismillah. HbA1c. Vitamin C, glucose, gluconolactone oxidase. Gluconolactone oxidase in humans and absent gluconolactose. L-gluconolactone oxidase. principal vitamin is strong reducing process. It reduces the diet 2,6-dichlorophenol, indophenol, 2,6-dichlorophenol, indophenol into 2,6-DCIP. Reduces to dehydroascorbic acid. Is oxidized form. The appearance of blue color into colors. So vitamin C A जो है strong reducing agent है, so वो reduce करता है to 2,6-dichlorophenol indophenol को, and it gets oxidized itself to dehydroascorbic acid. ठीक है, and when 2,6-dichlorophenol indophenol 2,6-DI reduce DIH2, this blue color becomes colorless. Imparts pink color. Color is formed. At the end of the day, no more vitamin C is available for the reduction of the dye. The excess oxidized dye, it becomes pink color. So this is vitamin C is a strong reducing agent, so it reduces 2,6-dichlorophenol indophenol, and it becomes oxidized itself into dehydroascorbic acid. When it reduces it, normally it's a blue dye, but it becomes colorless. But when all the vitamin C gets used up, once it gets used up, the excess DI it forms a pink solution. Metaphosphoric acid stabilization. 2 ml of orange juice in a beaker, 8 ml of metaphosphoric acid titrated against DI solution until colorless. 1 ml of DI solution. (0.025 mg ascorbic acid). 0.01 ml sample. 1 ml 0.025 mg. 1 milligram per deciliter. Cause scurvy. 0.5 to 1 mg. Collagen formation, bone formation, metabolism, tyrosine metabolism. It's for norepinephrine. It's for the hydroxylation reactions. Lethargy, bleeding gums, petechiae, bleeding gums, petechiae, lethargy, myalgia. done with this, alhamdulillah. So vitamin C is a strong reducing agent. It reduces the dye, the blue colored dye, DI. 2,6-dichlorophenol indiphenol, and it becomes oxidized itself into dehydroascorbic acid. This dye, when it gets reduced, it becomes colorless. But once all of the vitamin C in the sample is used up, the excess oxidized dye becomes pink. Okay, done. HbA1c. Hemoglobin is a protein. The tetramer globular protein, which main function is the transport in blood, blah blah blah. Assembly of 4 globular protein subunits, these are alpha chain protein, porphyrin, hemoglobin, fetal hemoglobin. Alpha or gamma chains, fetal hemoglobin have higher affinity, sickle cell disease, beta thalassemia. Adult hemoglobin, alpha beta, alpha delta chains, abnormal. HbA1c. Form hemoglobin not bound non-enzymatically to sugar, which may be glucose, fructose, or galactose. Glycated hemoglobin is preferred with glycosylated hemoglobin as it reflects the correct non-enzymatic process of lysated hemoglobin. Glycosylated. Hemoglobin is bound non-enzymatically to sugar. Exposure of hemoglobin to high levels of plasma glucose. When the glucose is high, glucose will attach to. If a shift base is produced. Rapidly, glucose bound hemoglobin. Hemoglobin is glycated remain this way. Condensation reaction occurs between glucose and the N-terminal end of the beta chain. This reaction with shift base. The second conversion is an example of Amador rearrangement, isomerization, or rearrangement reaction of the N-glycoside. Forms an amide glucose. Forms a shift base undergoes Amador rearrangement. Glucose forms an amide linkage with Amador rearrangement of the glucose hemoglobin जो है non-amide होता है glucose condensation in the beta chain occurs N-terminal end of the beta chain. Shift base is produced. Shift base is then there's a called amide rearrangement which forms Z HbA1c. A B C. N-terminal valued residue. and terminal valine residue glycation side. Vacuum containing EDTA. Lavender. It's EDT lavender pink. CBC के लिए 5.7 to 6.5 is pre-diabetic. 0.5 plus is diabetic. Why do we perform this test? It gives the estimation of the average blood glucose over 2-3 months. It is used in conjunction with other tests to monitor blood glucose, such as fasting and random blood. Can be done at any time. कभी भी कर सकते हैं कभी HbA1c stress hyperglycemia for predicting complications. Cannot be used as an emergency test. Hypoglycemia more sensitive to sin than repentance. Elevation through control, but if it's borderline, it can ensure good control in the recent past. Not sensitive in us for gestational diabetes mellitus. Decreased in anemia. Decreased in anemia. तो HbA1c टेस्ट जो है हम emergency में यूज़ नहीं कर सकते ठीक है emergency you cannot use it as an emergency. It's more sensitive to sin than repentance, meaning that if it's over 6.5% then okay it shows that there's poor control, but if it's borderline it cannot confirm whether there was recent control or not. And it decreases if there's anemia because there's overall just less RBCs, bleeding as well. Cannot register hypoglycemia. Hypoglycemia, and not sensitive enough for gestational diabetes mellitus. Shall I remember this? Oh my goodness, are you serious? Most protein sugars non-automatically lead to the formation of advanced glycation stages. Rages, advanced glycation, and ages are when proteins that react with glucose sugars non-enzymatically from advanced glycation end products. Advanced glycation end products usually are for the receptor advanced glycation end products, and they trigger oxidative damage, stress. We're done. You can act as enzymes, protease inhibitor. Long venous chain, polypeptide chain. Act as enzyme complementary inhibitors. Hey Siri, is hemoglobin considered a plasma protein?
Okay, I found this on the web for is hemoglobin considered a plasma protein? Check it out.
Did you read it for me?
Okay, I found this on the web for could you read it for me? Check it out.
Oh, Siri is so dog shit. Like, how many years of development does it take for a follow-up question? What is the point of Siri if it can't do something as simple as that? Fucking retarded. Is hemoglobin a plasma? Oh yeah, it was in RBCs, not there. Not bad. Mm. 50 minutes and I'll go sleep, inshallah. Maintains the oncotic pressure. Participates in the immune system. अल्फा 1 एंटीट्रिप्सिन अल्फा 2 में हमारे पास आता है सिरुलोप्लाज्मिन बीटा में है बीटा ग्लोबुलिन we have transfer gamma globulin. Biorate reagent is used for both qualitative and quantitative analysis of protein. Proteins react with cupric ions in alkaline medium, form a violet-blue complex. Proteins, they react with cupric ions in an alkaline medium to form violet-blue complex. Who's exactly what Los Quitos. Carbohydrate. Oh my days, you know where you are, where you okay. Eating kinase, we don't. We know that. Oh my goodness, we got some beautiful principles up in here. We got 2 more principles left now. We have a biorate reagent. It is used for both qualitative and quantitative analysis of proteins. Yeah, but proteins have cupric ions. This may be alkali, ये भी alkali है. Reduce the cupric ions. alkaline medium to form violet blue complex. Intensity of the violet colors per meter 540 nanometers. तो proteins जो हैं वो react करते हैं with cupric ions inside of an alkaline medium, and they form a violet blue complex. The intensity of the violet blue complex is proportional to the concentration of the 540 nanometer. Sodium carbonate. में जो है proteins react करते हैं with cupric ions to form violet blue complex, and the intensity of this is six to 8.3 grams per deciliter. Hyperproteinemia, hypoproteinemia. Hyperproteinemia, so the serum protein levels are greater than 8.3 grams per deciliter. So we can have an increase in both A and G in albumin and globulin. This is in dehydration relative hyperproteinemia. Or we can have a decreased AG ratio, that means we have an increase in globulin, and this is because of an immune response, chronic infection. Chronic infection. Multiple myeloma. Hyperproteinemia. Serum protein is less than 6.7, 6.7, 8.3. Liter. So we can have because decreasing globulin, or we can decrease it. So the A to D ratio can in hyperproteinemia can increase or it can decrease. If it increases, that means we have a decrease in globulin because of A gamma globulin. A gamma globulinemia cause increase in AG ratio in hyperproteinemia, or it can be decreased ratio because of decrease in albumin. When does albumin decrease? In renal disorders, nephrotic syndrome, chronic liver disease, cirrhosis, malnutrition, malabsorption, burns. It's more important, you know what I'm saying? RCC. renal disorders, renal disorders. We have chronic liver disease, cirrhosis, chronic malnutrition, malabsorption, burns. Okay, so we have hyperproteinemia and hyperproteinemia. Hyperproteinemia is when it's more than 8.3 grams per deciliter, and this the ratio can either remain the same. That means both of them have increased. So relative in dehydration can occur in dehydration, and if we have an increase in the ratio, decrease in the ratio, that means the globulin has increased, and this could be in chronic infections, multiple myeloma. Now, in hyperproteinemia, the protein levels are less than 6.7 grams per deciliter, and the A to G ratio it can be two effects on it. Either increase or decrease. If it increases, that means globulin has decreased, and that can occur instead of A gamma globulinemia. But if it increases, that means we have a decrease in albumin. It decreases, but if it decreases, that means I have a decrease in albumin. I have a decrease in albumin, and this could be due to renal disorders. It could be chronic malabsorption, chronic cirrhosis, chronic malabsorption, cirrhosis, burns, malabsorption, malnutrition, liver disease, renal disorder, burns. Pitting edema is seen in hyperproteinemia. यार ये क्या बकवास है यार. Yo, chat, what is going on? It's 2:30 a.m. We're freaking studying, chat. What is going on? Got an exam in a couple hours. I gotta have to sleep soon, though. Good evening. Freaking. Can't say tomorrow, my bad, bro. I'm trying to lock in. Edema looking ass. Pitting edema, so hyperproteinemia. Pitting edema, non-pitting edema. Hyperproteinemia. Pitting edema, non-pitting edema. Pitting edema is in heart disorders, kidney, liver, lymphedema, myxedema, lipedema. Oh shit, hold on. The non-pitting, it's in lymphedema, myxedema, lipedema. We got all three, you know what I'm saying? Lymphedema is infection, tumor and shit, you know what I'm saying? Myxedema is myxedema. Lipedema is obesity. Fat ass. Alright, we got pitting edema, heart disorders, kidney, liver, heart, kidney, liver. Medications, protein levels. Okay. Lymphedema, myxedema, lipedema. We're done with this. Time to head on to amylase. Tensiometry. Amylase is a hydrolytic enzyme. Starch into amylase, amylopectin. The foot pick is liver issue. It could be because of liver issues. Yes, you're correct. Liver issues, heart issues. Kidney issues, lymphedema, myxedema, lipedema, obesity, all of that bullshit can lead to that. Oh my goodness. Can fatty liver lead to edema? Legs and ankles. Alpha amylase, beta amylase, gamma amylase. Alpha amylase, salivary and pancreatic of this type. Anyway, the substrate beta amylase is by bacteria. B for bacteria, fungi, and plants. Gamma amylase, bacteria, fungi, humans. Okay, only alpha and gamma in humans, bacteria, fungi, plants. Okay. खेल खत्म है नहीं खेल ही खत्म क्यों खत्म है बस इसके बाद ये सीरम इलेक्ट्रोड बाकी है फिर बस उसके बाद सोऊंगा योर खेल खत्म फकर डोंट किल लुकिंग एस ओए फिजिक्स प्रैक्टिकल एक दिन में हो गया कितना मुश्किल था कुछ याद नहीं रहेगा ओ नहीं यार आसान है फिजिक्स प्रैक्टिकल एक दिन में हो रहा था सारे। कितनी देर लगी तुम्हें? कितने घंटे? मुझे सब भूल रहा। और नहीं, एग्ज़ाम के वक्त याद आ जाता है, ऐसा लगता है अभी। मतलब मेरी 6 घंटे में ब्लॉक 1 2 3 हो गए पूरा बायो केम का। आई एम डन। कितने घंटे लगे तुम्हें? टाइम बताओ। अच्छा, तुम तो मतलब डिफरेंट आदमी हो ना फिर। मेरे साथ ये हिसाब नहीं चलेगा 7 से 12 वाला। 7 से 12 मेरा ब्लॉक 1 होगा शायद। ब्लॉक 3 हो जाएगा 2 घंटे में। ब्लॉक 2 में था क्या, मैं सारा भूल गया। कुछ नहीं, कुछ नहीं। नींद नहीं आ रही है बहुत मुझे भी बहुत नींद नहीं आ रही है। मैं 30 मिनट्स में सो जाऊँगा, फिर सुबह निकलूँगा, 6 बजे उठूँगा। 2 3 छोटे हैं। हाँ, 2 3 काफ़ी इजी थे, मुझे याद है। 1 बहुत, पता नहीं 1 के पता नहीं कितने चैप्टर हैं बकवास। टू क्लोरोफोर नाइट्रोफिनाइल। अच्छा, ये तो याद नहीं करना। ठीक है, ठीक है। TNP बनता है। एक है थोड़ा लंबा। 11, हाँ यार बहुत ज़्यादा एक। वो बंदा मैंने देखा है प्रॉपर लॉक इन करे तो बहुत जल्दी हो जाता है सारा। अभी मैंने आधे घंटे से प्रॉपर लॉक इन किया था, पता नहीं मैंने कितने चैप्टर कर लिए इसके मौका दिए। अम्मा गो बाय, गुड बाय। लॉक इन एज वेल। अल्फा माइलेज CNPG3 to form C मैंने लिखा है यहाँ PG, यहाँ तो CNDG लिखा है। CNP होगा। CNPG3 create a formation of 2-chloro-4-nitrophenol. CNPG2 to is directly proportional to consider serum amylase 404. ठीक है। CNPG3 hydrolyze करता है अल्फा amylase CNPG3 to CNPG2 और CNP रिलीज होता है। ओह यार मेक सेंस, CNPG3 हो गया ना, CNP एक निकल गया तो CNPG2 होगा ना। 3 minus 2 or 3 minus 1 is 2, and then we also have release of G3 and G. G is for glucose. Maltotriazide, maltotriose. Maltotriose and glucose. Maltotriose and glucose. G3 glucose. Alpha amylase hydrolyzes CNPG3 to form CNP to release CNP and CNPG2, as well as maltotriose and glucose. Maltotriose is G. This is what G3. Alpha amylase rate of formation of CNPG2. Formation of CNP is directly proportional to concentration of CNP. अच्छा, CNP 404 nanometer. CNPG3, CNPG2, CNP maltotriose glucose. ठीक है. Some are gonna be blood, urine, PG, no alcohol intake, no medication, aspirins. ठीक है. 40 to 140 की बात हो रही है. Increased serum amylase, acute chronic bronchitis, parotitis, gastroenteritis, pancreatic carcinoma. Blunt trauma to the pancreas, acute chronic pancreatitis, alcoholism, liver disease, ectopic pregnancy, cholecystitis, parotitis, salivary amylase, pancreatic carcinoma, pancreatitis, parotitis, gastroenteritis, cholecystitis, alcoholism. Information that can causes gallstones, heavy alcohol use, causes of acute gallstones, heavy alcohol use, trauma, hypertriglyceridemia. Gallstones की वजह से होता है, heavy alcohol trauma की वजह से. Cathepsin occurs when there's abnormal digestive enzymes within the pancreas through inappropriate activation of inactive enzymes. Trypsinogen जो है activate होता है cathepsin से lysosomal enzyme which activate trypsin. Active form of trypsin that leads to further activation of the molecules of trypsinogen. Inflammation, edema, and cellular death. Serum amylase level acute increase in acute. Using acute pancreatitis, cellular damage and necrosis, leading to release of these enzymes into the bloodstream. Decrease in heavy alcohol use, cystic fibrosis, liver, kidney disease, fibrosis. Okay. Electrolytes are substances that have a natural positive or negative electric charge and dissolve in water. Serum electrolytes are minerals in the blood and fluids that carry the electric charge. Blood negative charge, the blood that carry the electric charge. Acid-base balance, blood clotting. Muscle contraction, signal transduction. Sodium muscle body, sodium response, extracellular fluids where regulates the amount of water in the body. Potassium and intracellular amount of potassium is important. Treatment can affect heart's rhythm and ability to contract. Chloride moves in the cells maintain electrical neutrality by maintains stable pH and electrical neutrality as well. Electrolyte has plasma. Pairing with the reagents, electrode module, sensing pump, sample probe. Electrolyte analyzer measures electrolytes in serum plasma urine. Reagent pack है, crystal से pump है, electrode module sample probe. Electrode module, reagents pack है, crystal से pump है.
Probe assembly, probe arm, probe arm, ये वाला electrode assembly, peristaltic pump, peristaltic valve, और जो electrode assembly है, in that electrode assembly, first one is potassium, sodium, and it is lithium, and it is reference vehicle. This is display, and this is their printer.
Sample probe, probe arm है, sample probe है,
Electrode assembly,
electrode assembly,
peristaltic pump, peristaltic valve, और जो electrode assembly है, in that electrode assembly, first one is potassium, sodium, and it is lithium, and it is reference vehicle. This is display, and this is their printer. Thank you.
We have the sample probe, probe arm, peristaltic pump, reagents pack, peristaltic valve, और फिर electrode module. The serum electron analyzer works on the principle of potentiometry.
This week, Tuesday. Student in particular, stop. Stop. Your man. When you like, we were talking about sure of the school 16 said, see my students keep calling elder. Tired of it. Students this week, Tuesday.
Oh my goodness. Serum electrolyte analyzer works on potentiometry. Electrolyte analyzers typically employ electrochemical sensors such as ion selective electrodes to detect specific ions in the sample. This method measures the voltage that develops between the inner and outer surfaces of an ion selector. Ion selective electrodes to detect the voltage that develops between the inner and outer surface of ion selective electrodes. Measure the voltage that develops between the inner and outer surface of an ion electrode. Such a horrible principle and explanation. I don't know who came up with this stuff. Serum electrolyte analyzer works principle of potentiometry. So we have there's electrochemical sensors such as ion selective electrodes. Have ion selective samples. This method measures the voltage between the inner and outer surfaces of an ion selective electrode. Potential is measured by comparing to the potential of a reference electrode. So it works on the principle of potentiometry. So we have ion selective electrodes, electrochemical sensor employ ion selective electrodes, and they detect specific ions in the sample. And basically, the voltage that develops between the inner and outer surface of the ion selected electrodes, it measures it and is measured by comparing it to the potential of a reference electrode. Okay. So the serum electrolyte analyzer works on the principle of potentiometry. We have electrochemical sensors such as ion selective electrodes. These measure selective ions to detect specific ions in the sample, and it measures the voltage across the inner and outer surfaces of the ion selective electrode, and it measures it with reference to a reference electrode. Compared to potential voltage that develops between the inner and outer surface of an ion selective electrode, and measures it by this potential is measured by comparing potential of a reference electrode. Okay. The principle has potentiometry. It basically deploys there's electrochemical sensors such as ion selective electrodes. These are for specific ions, and it measures the voltage across the inner and outer surfaces of the ion selective electrodes, and measuring it by comparing the potential of this to the potential of a reference electrode. Alhamdulillah. Offer sport juices. We're done, alhamdulillah. We are done, chat. It's time to sleep and go give the exam in a couple hours. I'm gonna have around 2.5 hours of sleep. Not the best, but it is what it is, you know. Alright, I'm gonna see you guys tomorrow. I have a ton of shit to do tomorrow. Ton of shit, bro. God damn. Alright, see you.